Currently, patients with marginal zone lymphoma relapse after frontline treatment have access in the United States to two oral BTK inhibitors. One is called Ibrutinib and one is called Ibrutinib. They both have a very similar mechanism. By targeting BTK, they primarily try to attack the B-cell clone, but also indirectly, they both favorable impact on the tumor microenvironment with increasing T-cell function, mostly with Ibrutinib, which is also an ITK inhibitor, and potentially improvement in the phenotype of tumor-associated macrophages, mostly with Ibrutinib, which is more a BTK-specific inhibitor. Ibrutinib is an oral BTK inhibitor, more potent and specific than Ibrutinib. It's currently approved for multiple types of B-cell lymphoma, mostly low-grade B-cell lymphomas, but not for marginal zone lymphoma. Due to the fact that it's more specific for BTK, not only its use may translate into a higher efficacy, but also into a better safety profile as compared to Ibrutinib. As a matter of fact, currently the issue with the use of Ibrutinib in B-cell lymphoma malignancies in general and marginal zone lymphoma more specifically is the onset of off-target effects, mainly due to action on FLT3 and other BTK similar targets. In this phase 2 trial, we use Acalabrutinib at the standard dose of 100 milligrams orally twice a day until progression or toxicity. And we enroll more than 40 patients with the expectation to be able to see a response rate higher than 20 to 30%, which is what we currently tend to see with single-agent Ibrutinib in this patient population. The overall efficacy and safety data were very promising. After a very long follow-up, we saw a response rate in more than half of patients and a complete response rate in more than 30% of patients. With all the limitation of inter-study comparison, definitely performs favorably as compared to single-agent Ibrutinib in this patient population, and probably similar to what Ibrutinib also does. In terms of safety profile, we didn't see any major safety concern. Typically, with the use of BTK inhibitor, there's some potential concern for cardiovascular complications, but also for excessive bleeding due to platelet dysfunction. And none of these adverse events, either low-grade or high-grade, were observed in this trial, consistently and concomitant with what we already see also in other B-cell lymphoma malignancy. So in this phase 2 study, Acalabrutinib did show a very promising safety profile. Based on this data, we hope that in the next several months, we will be able to have Acalabrutinib in our guidelines and give you the opportunity to all patients with marginal zone lymphoma to access this oral BTK inhibitors as a second-line option at time of relapse after frontline other chemotherapy, immunotherapy, or single-agent rituximab.